in nutritional psychiatry. So nutritional psychiatry is an area of research and practice which link what we eat to our mental health. And in the last 10 or so years, it's a relatively new discipline. In the last 10 or so years, we built a lot of evidence that quality of our diet is directly linked to our mental health. So the better we eat, the better chances we have to have a better mental health. I'm going to talk a little bit about diet, but I also want to tell you about the amazing research program we have in our Food and Mood Center. So we'll look at topic of nutritional psychiatry right across the life stages, starting from early life, even before people born. We understand that health of mothers, what they eat, and health of fathers and what fathers eat is very important for mental health of their offspring as well, of the children. So not just physical health is impacted, mental health is impacted as well. And we'll look at this relationship right across different life stages. We generally know that eating better quality diet reduces your chances for developing depression by about 30%. Prediabetes is a huge issue. Depression is an enormous issue as well. So eating better can help us essentially with both. In our center, we focus a lot on mental and brain health and impact of food on mental and brain health. How these actually link, how it's built, what are mechanisms behind those links. We study a lot gut microbiome. That's a very interesting area of research, and I cover this today. But we also look at physical activity and very important different behavior and environmental factors which might predispose people to certain disorders. Within the center, I lead Food and Mood Academy. And the role of Food and Mood Academy is to translate and to educate, to deliver the evidence into professional practice and into the hands of consumers. So my job, I don't have too many publications because I speak. I don't write, I speak. I educate, I usually work with health professionals such as psychiatrists and general practitioners, psychologists, dietitians, nurses, to upskill them in this topic of nutritional psychiatry, to help them help the patients to change for the better. So today I'm going to cover a few topics. I'm going to talk about stress. I'll talk about microbiota gut-brain axis, very interesting area of research. I'll talk about the impact of the axis on glycemic control. I'll talk about stress-induced alteration in gut microbiota and what does it actually mean? Is it important? I'll talk about changes in gut microbiota in pre-diabetes. Do we see any changes? What do they tell us? I'll talk about diet and gut-related interventions and what we currently know and what we currently use in our practice. And I touch on some challenges in implementations. So before I proceed, I want to cover just a couple of contexts here, or a couple of points. So I'm going to be talking about stress, and there's different definitions of stress, but essentially, it could be described as inherent response within an individual triggered by external force. Just think about me trying to cross the road yesterday in Mumbai. It's my first time in Mumbai, so I think I experienced every possible level of stress there. So, and unfortunately, stress can significantly increase our predisposition for physical and for psychiatric disorders. And we understand as such, people who exposed to high level of stress have much more tendency to develop metabolic disorders such as diabetes, to develop mental health conditions such as depression or even post-traumatic stress disorder. And existence of both physical and psychiatric condition only contributes to the stress. and creates that vicious cycle. What is good about this cycle, that addressing one factor will potentially preventing or managing other factors as well. Addressing stress will make our physical health better. Dealing with our physical health will improve our psychological health as well. I'm also going to be talking today about gut microbiota or gut microbiome. So there's a couple differences. Gut microbiota, it's usually all the microorganisms which live inside and on us, so in us and on us. And gut microbiome is a complex environment we have in our gut. It's like whole universe, and it's amazing, it's diverse, and it's so little we currently know about it. Although it's been so much development in this area, and you probably hear gut microbiota everywhere, but we know so little, and there's so much more we don't know than we do know. What we do know that gut microbiome is, of course, is a home to trillions of microorganisms. In fact, the cells of microbiota in our gut significantly outnumber the cells in our body. Most of genetic material we carry with us belongs to our microbes, not to us. Microbiota, of course, being linked to many conditions, to many issues, states of health and disease in our body, because it does evolve with us, it's lives with us, and participates with us in many important functions of the body. So gut microbiota does reside in the gut, and it provides a very good cover for the gut microbiota. I'm just trying to see, oh, you can't see my pointer, that's all right. Just think about the lumen and think about the cover, that's where the gut bacteria lives. There's few layers in our gastrointestinal tract, and each layer, of course, very important to maintain the homeostasis. Along with just hanging there in our gut gut bacteria have a lot of very important roles. Gut microbiota participates in digestion of complex carbohydrates, which we as humans, we can't really metabolize them. So a lot of them pass through our gastrointestinal system and get metabolized by gut bacteria. Gut bacteria also extracts beneficial and bioactive compounds from a food we eat. It produces metabolites, such as short-chain fatty acids, metabolites which are very important for gut issues, but also have systemic, broader implication for our health. Gut microbiota participates in synthesis of vitamins, K and B and many others. It's maintained this intestinal barrier, which is very important as well. Just think about my previous picture. And it's, of course, a very important regulator of our immune system. When we talk about microbiota gut-brain axis, we refer to this bidirectional communication, which continuously happening between our gut microbiota, and various centers of cognitions and emotions in our brain. There's constant communication, and it has to be in some kind of balance to actually, for our body and for our mind, to work properly. We understand that our brain influences our gut microbiota and impacts its composition and therefore function. There's some amazing research showing that people who, for example, were in a car crash or some sudden trauma to the head showed the changes in gut microbiota within 24 hours. In turn, our gut microbiota also sends the messages back to the brain, which are very important. These messages are essential for so many different activities happening in our body. There's several mechanisms involved, and we understand that there's neural, endocrine, immune, and metabolic pathways all participating in this communication. Let's have a look how microbiota gut-brain axis actually interacts and the role of microbiota gut-brain axis in glycemic control. Overall, of course, our gut holds a very central position in onset, but also in control of many metabolic diseases. And it plays a critical role in glycemic control as well. As we ingest food, our gut works on detecting, analyzing, and then communicating essential information back to our brain. How does brain meant to know what is actually happening there? So brain receives this information from our gut, our second brain, about any incoming nutrients, and by this, our gut facilitates appropriate regulation of energy and also glucose levels in our body. This communication process involves release of peptides and hormones from the gut in response to the nutrients. Our gut produces, gut microbiota produces neurotransmitters, as I mentioned before, and this can directly or indirectly impact this process. For example, metabolites which are produced by gut microbiota can impact the release of gut peptides, so they can regulate gut peptides. They can also influence production of serotonin in the gut. Along with previously mentioned short-chain fatty acids, our gut microbiota also produces metabolites such as lipopolysaccharides, or LPS. LPS are components of the pathogenic bacteria. It's found in the outer membrane of pathogenic bacteria. And we'll come back to LPS and the specific role LPS plays in progression of prediabetes to diabetes later in my talk. So this signaling of gut microbiota by metabolites can impact and alter communication along the microbiota gut-brain axis. It impacts the messages our gut microbiota sends to center in our brains, which are actually responsible for glycemic control. So prediabetes, as many other states of health or disease in the body, rely on appropriate signaling along the microbiota gut-brain axis. So this is very important for development and progression of prediabetes. But what actually important for our gut microbiota? When we consider the factors which impact composition and function our gut microbiota, you can appreciate there's many of them. This diagram represents the ones which probably closest to my talk today. So as you can see, it all starts before we even born, with our genetics, then with our parents, and we see that diet of mothers in pregnancy then influence gut microbiota composition of children. In our center, fantastic Dr. Sam Dawson actually working a lot with pregnant mothers to see if change in diet can help to improve the gut microbiota composition of the kids, and it can. Then our lifestyle, any lifestyle habits we develop in life, how much we exercise, what we eat, how often we eat, our environment. There's some amazing studies showing that even if you have pets, like dogs or cats, or who you live with, all of these gonna impact your gut microbiota composition. There's also other factors, as our cognition, level of stress, medication we take, our social interactions as well. Social interactions being shown to be one of the most beneficial predictor for not developing common mental health disorders. Social interactions are very good for your gut microbiota as well. So get yourself some friends with a good, healthy gut. In line with my talk, I would like to have a look a bit closer at what actually happening with our gut under stress. We understand that psychological stress quite often manifests itself in many gut conditions. But let's have a closer look. By the way, as mentioned, very new area of research. A lot of evidence we're gonna discuss today gonna continue to grow and change, and a lot of unknowns as well. But that's what makes it very interesting and exciting, all the possibilities. Remember at the beginning of my presentation, I described the stress as an inherent response within an individual triggered by an external force. So the primary role of stress response in the body is of course enhance the survival by focusing behavior, by freeing energy to be available for responses. So it's also our body in response to stress restrains any energy consuming processes which are not urgently needed. So our body gears up for that flight or fight response. So body primes that by releasing various factors. There's so many of them. I'm just gonna talk about a few which relate directly to immune system and to systemic inflammation and glycemic control. So what we understand that under stress, our HPA axis start firing various steroids, including glycocorticoids. And the previous speaker mentioned the importance of glycocorticoids as a risk factor for developing of prediabetes. So, and these are released by our body under stress. What also happens in the process of the stress, this release inhibits any, as I mentioned, non-essential processes in our body. For example, immune function or digestion. Understandably, the long-lasting stress due to, whatever severe factors might be happening in our life predisposes us to many issues, gastrointestinal issues such as IBS, irritable bowel syndrome. It's very common, particularly in Western countries. 1 in 10 have IBS. It also predisposes us to various abnormalities of brain, such as depression, and abnormalities in the body, such as prediabetes. So we understand that our gastrointestinal tract or our gut is very complex, and explanation here might be oversimplified, but I'm a dietitian first, and I'm going to present that from a dietetic perspective. So as I mentioned before, our GI tract is very sophisticated multi-organ system, and it preserves homeostasis by using this so-called selective permeability. Just think about how the stuff we eat doesn't go everywhere in the body. Why does it stay where it needs to stay? It's because of our very sophisticated gut system, which actually works on maintaining the nutrients and eliminating the waste. That's the important mechanisms there in our gut. And gut microbiota participates a lot in these mechanisms. So it acts as a barrier, as a chemical, as immune barrier to lots of nasties to make sure that they don't actually spread all around our body. We understand that the signaling I mentioned before between our microbiota and our brain is very important in this process as well. In acute stress, well, there's many unknowns. As you can see, we don't really know what exactly happening, what are mechanisms, what triggers gut responses and acute stresses. But what we said, or what is suggested right now, it's that during acute stress that our enteric nervous system might become active, leading to changes in gut contractility. Remember I said that in a flight or fight response, body preserves all the energy for this response. So gut contractility or motility is not decided by body as something very important. This decrease in contractility also link to changes into serotonin metabolism. You probably heard that our gut have a lot to do with serotonin or levels of serotonin in the body. We don't know if it's that serotonin produced in the gut actually crosses blood-brain barrier, but it's definitely there, it's important. We also understand that in our gastrointestinal tract, even with acute stress, there's activation of innate immune system. So innate immune system is our first line of defense. So think about if it's become activated with stress, it's not going to worry about anything else. It's not going to worry about protecting or supporting body against anything else. Acute stress also sets off visceral pain, so that you know that in the West, in Australia, they have a saying, "Oh, you pain in my gut." So it's that stress, oh my God, you give me pain in my gut. So that's essentially a reaction of our gut to stress. We understand that acute stress also suppresses our adaptive immune system, so our second line of response. All what we learn over the years how to protect ourselves from pathogens. Stress response actually really diminishes our every line of responses against everything else. Acute stress, of course, changes gut permeability, which is important. Remember, we need to keep stuff inside of our gut. And interestingly, some human studies show that acute stress had a greater effect on intestinal permeability in people with moderate level of stress than on those with low level of stress. It means that if you ever need excuse to relax, think about your gut. Your gut needs it. Your gut needs that relaxation. We understand that prolonged chronic stress linked to extensive maladaptive alteration across all our gut. I'm not going to go into it too much, but I can tell you that it definitely disrupts gut motility, so there's all gut issues like constipation or diarrhea, they can come from this. It triggers visceral hypersensitivity, and we see that in gut disorders when people have this continuous gut pain without no apparent reason. We call that visceral hypersensitivity. We understand that chronic stress can start impacting on this wonderful layer, this immune protection layer in our gut, thinning that out and increasing permeability. The changes in gut are quite significant too in gut microbiota, and notably there's reduced stability in our gut microbiota taxons, particularly a decline in relative abundance of beneficial bacteria, which we all need. There's always that complex balance between beneficial bacteria and not so beneficial bacteria. So stress declines the abundance of beneficial bacteria. And look, at least one of the explanations why people living with severe mental disorder have very different gut, microbiota gut composition. I'm just plugging this study which done by our team investigating 3 severe mental health disorders, schizophrenia and bipolar and unipolar depression. And it showed quite extensive changes in gut microbiota in people living with these conditions. Again, I'm not going to go too much into it, but if you're interested in gut microbiota and the role of gut microbiota in psychiatry, have a look at that. I'd like to say a couple of words here on disorders of gut-brain interaction, and they previously were called functional gut disorders. As I mentioned, they a big problem in our society, in Western society, with IBS being very, very common and prevalent. And research also shows us a high prevalence of these disorders in people with anxiety, depression, and stress. It's not always clear what comes first, whether gastrointestinal issues triggers anxiety or stress, or where stress is then cascade down to gut issues. What we do understand that these are linked, and these present a very serious issue in treatment. I'm plugging this because one of my PhD students, wonderful Maddie West, just submitted her thesis. It was a long road, 4 years, where she investigated the link between gut issues and anorexia nervosa. So anorexia nervosa is, of course, a psychiatric condition with the highest prevalence of mortality and morbidity. And Maddie worked in her research a lot with lived experience people who live with anorexia nervosa, but also with gut issues. And what she found out, that gut issues quite often were #1 barrier in treatment. So when you treat your people with prediabetes and try to change their diet, be sure to inquire why they're reluctant to change the diet. Are they eating the same stuff because they found it doesn't upset their guts, it doesn't upset their tummy? So I'm just encouraging you to look at this from slightly different perspective. Gut microbiota also plays important role in prediabetes, as I mentioned, and prediabetes linked to significant compositional shifts in our gut microbiota. We understand that, of course, prediabetes is a combination of very complex intrinsic factors. Factors such as genetics, which we can't change in a hurry. What we can change and try to change is our gut microbiota and its impact on every other outcomes, including metabolic outcomes. There's few studies which actually analyze the gut microbiota of people with prediabetes, because both concepts are very new. They did show the changes in relative abundance of beneficial bacteria. So very similar picture like we see in mental health conditions. Meaning that if you treat prediabetes, chances are you might be managing mental health conditions through gut microbiota as well. Another mark factor or mark characteristics of changes in gut microbiota composition, it's a reduction of taxa, which produces short-chain fatty acids. Remember those fatty acids which are very important for our gut health. And usually taxa which produces short-chain fatty acids are commensal beneficial bacteria. So we need to support that, and we need to understand the potential impact. Those decreases in beneficial gut microbiota lead to so-called dysbiosis. You probably heard concept of dysbiosis. Leaky gut that increase intestinal permeability, and finally to endotoxemia. So endotoxemia and systemic inflammation is one of the major risk factors which predisposes people with prediabetes progressing to diabetes. There are many other factors, as our wonderful speakers noted before me, but this is another one. This condition is often associated, as I mentioned, with intestinal permeability, with leaky gut, where the integral lining of our intestinal barriers is compromised. And this opens the passage of bacterial products such as LPS, remember lipopolysaccharides, those parts of negative gut bacteria, to actually leak out into our bloodstream. It sets off systemic inflammation, a very serious condition which impacts every aspect of our health. We know that, for example, depression is an inflammatory condition. So endotoxemia is responsible for that as well. There's few factors which can kind of contribute to endotoxemia, and of course poor diet with high fat, high carbohydrates, low quality diet being one of the main issues. So with all that, what do we actually do? What do we do in treatment? Well, I try to put together treatment options for pre-diabetes and also for mental health conditions such as stress. When it's come to mental health, diet becomes very important factors and importantly recognized factor in prevention and treatment of depression. Other diet and gut related treatments I want to talk to today with you about also all kind of focus on changing gut microbiota composition and therefore its function. And it's quite interesting, although there's some skeptics in terms of how we actually do that. And remember, the field is developing, it's very new, but it's good to know that we have additional avenues for treatment. Why not use them? Why not explore them? When it's come to diet, at least in mental health space, we understand that, as I mentioned before, better quality diet is one of the, don't want to say number one factor, really want to, but I shouldn't, it's not going to be evidence-based. It's one of the important factors which decreases your development of mental health conditions. It also can be used in treatment. In our center, we conducted first randomized controlled trial called the SMILES trial, which used diet to treat major depression. And I'm going to go a lot into that in a workshop we're going to be doing on Monday, and Professor Subhadra knows all the details. But to put that simply, we saw that when people with severe depression, so people who were referred to us by doctors, so it's not self-diagnosed, it's a medical condition, went on so-called Mediterranean-style diet, after 3 months of such a diet, 33% of the dietary group went into remission. 33%. It's people who were pretty much living with depression for a number of years. Everyone who improved their diet also improved their mental health outcomes. We also see several other randomized controlled trials showing very similar outcomes. Better quality diet supports changes in depression and the stress level for the better. Of course, I mentioned Mediterranean diet, it's most studied diet, but any diet with the common denominators, with high consumption of vegetables, and I'm not talking about white potato, I'm talking about green leafy vegetables and all other veggies, high consumption of legumes and nuts and seeds, and reasonable consumption of whole grains. Whole grains are important too, with good consumption of plant-based fats and good amounts of quality protein in their diet, and low amounts of so-called Western food. That's what basically works. So you can call this diet as pro-Mediterranean, Mediterranean style, or plant-based. Whatever you call it, it actually works. When it's come to understanding exactly how it works, we understand that, of course, good quality diet provides us with a lot of important components, such as fiber, polyphenols. It also includes proteins, and as I mentioned, as low amount of Western food as possible, because Western diet, that's what been linked to decreases in beneficial taxa in our gut, low production of short-chain fatty acids, degradation in our gut lining, increased gut permeability, and inflammation. So you can call the diet Mediterranean. There's a lot of evidence in the literature how to adapt this type of diet to different cultures. Adaptation is very important, of course. No matter how you call it, we all know what works. In terms of pre-diabetes, we of course need to adapt the portion size, we need to adapt the when we eat, what we eat, and one of the major issues become fiber. The more fiber, various fiber we consume, the better it is for our gut bacteria as well. It relies on this fiber. And the various aspects of different vegetables provide different type of fiber. Because it's not just one type of fiber. There's various types of fibers, and our gut microbiota needs all of them. We might need to adjust number of serves, type of food served, and we need to gear up for long-term changes. So it's a lifestyle change, as previous speakers noted. It's not a diet you go on and you sit very tight for 2 weeks, lose some weight, and then you're free. No, it's a long-term changes. And that's actually why people find that Mediterranean diet or Mediterranean style diet is good, because we start by telling people what to eat. We don't talk too much about restrictions. We keep that to the end. We start about you can eat so many veggies and so many fruit, and it's easier to follow. Another thing or another type of food I want to mention is fermented food. I love fermented foods. Who loves fermented foods? Yep. I don't know much about traditional Indian fermented foods. So instead of questions for me, could you do me a favor and send through the Minty app recommendations what I should try while I'm here? You can vote on that, and then we can do challenge, and I'll try all of it. So fermented foods, of course, been used in medicine for thousands of years. In Western medicine, it became to light in the beginning of last century, when very famous chemist and Nobel Prize winner Ilya Ilyich Mechnikov, who actually born and trained in Ukraine, and then Russia claimed him. He was the one, I'm Ukrainian, so that's why I'm not like this. He wasn't Russian, he born under Kharkov, so he was Ukrainian. Kharkov, which Russians now destroy, but that's another story. So he was the first who described this very interesting bacteria he found in the yogurt consumed by Bulgarian peasants. That's a happy Bulgarian peasants. He also noticed that Bulgarian peasants did have much better physical and mental health, and he attributed that to so-called probiotics. Currently, at least in Australia and in other Western countries such as UK and US, there's absolute explosion in popularity of fermented foods. Everyone wants to eat fermented foods. Everyone wants to like fermented foods. Not everyone does. Fermented foods can be a great addition to our diet. There's been some studies done in people with diabetes and pre-diabetes, showing that eating fermented foods can impact fasting blood glucose level, can also impact insulin resistance, but it might not be as useful on other aspects of diabetes. Just showing that, to us that fermented foods could be a great addition to healthy diet and other lifestyle changes, but of course not going to be product which going to change everything. I'm saying that because at least in Australia there's some claims that, eat fermented foods, fix your gut, and everything's going to be fixed. Look, fermented foods are good, but they're not going to fix absolutely everything. I need to fly through this now because I heard the bell. So 2 minutes?
5 to 7 minutes.
Oh, 2-7. That's a good gap. I like that. 2 to 7 minutes. I love that. Yeah, that's good. There have been a couple other studies showing that fermented foods are actually very useful in reducing the markers of inflammation. Remember, we talk about inflammation and systemic inflammation. So in healthy, at least in healthy people, fermented foods significantly decrease markers of inflammation and also decrease stress. There's a couple studies. I will be talking about them on Monday. Couple words on probiotics and prebiotics. Probiotics and prebiotics, of course, those types of supplements or naturally occurring substances we can eat. There has been a couple of studies showing that probiotics at least Lactobacillus casei can decrease glycated hemoglobin, HbA1c, and might also improve post-blood glucose levels. When it's come to prebiotics of course come to us mainly from vegetables and other fruits. They did not show much improvement in any kind of clinical aspects of prediabetes. In mental health, we also see that some of specific strains of probiotics are recommended for people with, say, depression and being very useful, but they work better for people with higher inflammatory markers because they, of course, first decrease in inflammation and by that impact their mental health. Last couple words on wonderful fecal microbiota transplantation. Again, at least in Western countries, very popular concept. Not a new one, because one of the first mentions of so-called yellow soup being used in Chinese medicine a few hundred years ago to treat some of their gastrointestinal conditions. In the current medicine, FMT is used to treat some of the continuous gut infections or chronic gut infections due to C. difficile, for example. Most of the evidence we currently have in FMT comes from preclinical studies. We do understand when it's come to studies in humans that FMT provides quite feasible and accessible treatment. We just finished a pilot study in our center which reported 100% participation in FMT trial. People who run studies know that you don't get 100% participation in anything. It means that people find FMT is quite okay, it's actually accessible. At least in Australia, FMT is very strictly regulated, which makes it very safe. There's been some interesting studies showing that FMT might improve insulin resistance, BMI, and also lead to beneficial changes in gut microbiota in people with type 2 diabetes. Similarly, few case studies in mental health. And look, it's exciting because particularly for people who we call so-called treatment resistance, providing any avenue for treatment is a good option than not to have them. So watch this space with FMT, it's developing, it's coming, and it's quite promising. What I wanted to note towards the end of my presentation, I am concluding, it will take a couple of minutes, that of course broader lifestyle factors are very important. People who live under constant stress will not be in a hurry to batch cook or learn new dietary skills. They stress. Often people with mental health issues, with depression, telling me, what do you want me to do? I'm not going to cook, I'm not going to do it, I'm barely surviving here. So good thing about lifestyle-based approach that we always can find something else which might work. And this is important. If we have someone who doesn't want to change their diet, well, maybe we can try something else. There's other opportunities there. We can't give up. We can't put people into that, box, they don't want to change. Maybe we haven't tried hard enough. If you would like to learn more, I do encourage you to follow our Food and Mood Academy. There's free resource for you to download in terms of diet for mental health. You could find that useful. We also have a lot of various online resources for you to access. I develop and run free online course on food and mood, which has been very popular. It's have over 85,000 enrollees from all over the world. I understand that 85,000 is not a big number for India. It's quite a big number for Australia. It's a fantastic course. It is free. It might be too introductory level for many of you here, but If some of you don't know much about diet or mental health, that could be a good course for you. We have more focused professional development course which been endorsed and accredited by Royal Australia and New Zealand College of Psychiatry, and it's specifically on nutritional psychiatry. It's been very popular. I have psychiatrists from all over the world completing this course. And another course too, we have courses everywhere. We have course in lifestyle management, so the broader approach which encompasses many sides of our life. I will be concluding now, and I hope that my presentation showed you that mental stress and gut issues, they are less considered in prevention or treatment of prediabetes, but they do play a very important role in both. There's few options which could expand our tools, our treatment, and can support us to treat prediabetes and stop it escalating. Thank you very much.